Good morning. You're listening to Caregivers Crossing, a podcast brought to you by Joy House. We are really happy you're here, and I think you're going to be happy that you're here too. Caregiver Crossing is a podcast created just for you, the caregiver. I'm Tina McIntosh.
I'm her friend, Terri Stacy, and we're here every week providing comfort and resources and hopefully some joy to our caregivers. It serves to embrace family caregivers, this podcast does, caregivers of today and also tomorrow. So thank you all so much for being here. Tina, let's talk about oral health, shall we?
Today we shall, and today we have two really great guests for you. Their names are Tina McIntosh and Terri Stacy. That's us. But we are going to talk about oral health.
Experts.
Yes, we do know quite a few things, and actually, Joy, our producer, has helped pull together a lot of statistics and information for us. But I don't think people understand the importance of oral health. And I will say, as someone who's had 184 surgeries in the last 10 years, anybody who's followed Caregiver Crossing since we were a radio program with Terri and me knows this. And one of the things, Terri, if you recall over the years that you and I found really interesting was they started having me do a certain mouthwash a few days before my surgeries. Do you remember when that became a thing and we talked about that on air? They would have me doing mouthwash.
Now I do, since you've mentioned it.
Yeah, and they talked about oral care and how important doing that mouthwash was prior to the surgery and then continuing that at home, which we should all be doing anyway, but let's be honest. I don't know about you. Sometimes I slip on that and I don't do the mouthwash or I don't do the flossing like I do the brushing. So
flossing, I think we all are behind when it comes to flossing. Even if we get the fancy, water picks and those, you think, okay, I'm going to do it now. I'm going to use that. And you just don't.
Yeah, I have a water pick and it ran out of batteries like 4 months ago. That's a whole different therapy session. Anyway, so oral health is really, really important for overall health. And it is something that they're studying even more and more in the last couple of years. And so normally the body's natural defenses and good oral health care, such as, daily brushing and that flossing and keeping that bacteria under control, those are really important things. But without proper oral hygiene, bacteria can get these, high levels that might lead to oral infections, tooth decay, gum disease. I'm here to tell you, if you've ever had oral health issues, it ruins everything. It controls everything. I can see why people, 50, 100 plus years ago drank, did drugs, threw themselves in front of a woolly mammoth. I don't know. It's just really life-changing. And so clinical studies have linked some of our current health issues, these periodontal diseases, to strokes and diabetes and Alzheimer's disease, heart disease, and other serious health problems. So on the other hand, healthy mouth lets people eat more easily, feel more confident about their appearance, and hopefully avoid tooth pain, tooth loss, and other health complications. So yeah, and caregivers have to worry about this stuff too. So let's talk about it.
Yeah, that's the part that you bring up. And that's part of caregiving. Nothing I ever thought about, but also caregiving means loving your mom, your dad's mouth, whoever you're caring for. That's another part of the caregiving regime that maybe I didn't ever think about. But yeah, you got to take care of their mouth too, right?
I mean, how many people do you think are caregivers and just don't? Because it's just,
I don't know. I don't know. I never thought about it. If I was a caregiver, I would not think about whoever I was caring for. I would not think about the mouth. Or when you started listing what oral disease can lead to, you said Alzheimer's, which strokes, heart issues. You don't think about that all being connected.
Yeah. And I don't know how those are all connected, but I mean, the reality is if you have poor dental health, it can lead to complications with other things. And I can tell you, if you have a loved one who's living with Alzheimer's and you're trying to care for their teeth, that's a whole different thing than a loved one living with stroke or, another diagnosis. And so it just becomes increasingly hard. And so let's talk about some of the solutions that we have for folks, because I think that's really helpful. There are assistive devices out there for so many things. So if you have a loved one who has had a stroke, has just gotten a diagnosis, particularly living with dementia, get them to the dentist right away and start to get them on some kind of a plan. My hope would be that you could get them into the dental chair more often, maybe than before, if that's something that is a comfort for them or is part of their long-term memory, that maybe your dentist is able to see them 3 or 4 times a year versus 2, or if insurance or private pay, if that's something that you can do, or get into some of the free dental programs, because that would be a big deal. But there are also, look up, dental assistive devices. There are ways that they can continue to be independent and brush their own teeth too. There are a lot of those devices, Terri, that you can put on the toothbrush, or you can buy a toothbrush where your hand can go in and wrap around and you can Velcro it on.
I had no idea.
Oh yeah. And the last thing you want to do is stick your finger in someone's mouth. I mean, do not put your finger in somebody's mouth who might, clamp down unintentionally or who might bite at you. But do you know how to get somebody's mouth open who doesn't want to open their mouth?
No, we've talked about this because sometimes as you get older, our loved ones lose their taste. Their taste for no other reason than they've just gotten older and they've lost that sense of taste. And we've talked about how to, that we don't want them to get sick. We don't want them to get dehydrated. We want them to eat. How do you get their mouth open?
Right. Or they might put something in their mouth and you need them to open it, but you can place your hand on the bottom of their chin and just press gently, and they will press against you and open up their jaw. And so you can do that and then kind of and start to, assist in brushing teeth, but don't put your fingers in there. So Terri, I know you've done some of your homework. So let's talk about what are some ways that you can help your loved one to select some tools that work best for them. What are some of those tools that might work better for them?
You can switch to a soft, rounded, bristled toothbrush. This is a great tool. I have switched over to a soft, rounded, bristled toothbrush myself.
You really have?
I really have, because my gums have become more sensitive. And look, I've got a mouthful of veneers and other stuff. And my gums have just gotten a little more sensitive. And even the softest of toothbrushes are still feeling that sensitivity. So I've found it's called extra soft. And the dentist says, it's still doing a good job. Just keep using it. You don't have to, use any more pressure. It's just a soft, extra soft toothbrush. And that feels good. And now I'm more willing to brush my teeth more often than when I felt like I was scraping my gums. How about that for a tool? You can also find a flossing solution that works for your loved ones. We talk more and more about flossing and how, we just do. That's the one thing that none of us do very well. But a regular floss is hard to manage. Try pre-threaded flossing tools that are what we've talked about, the water picks. And maybe you'll do better with it than I have with mine. Doesn't mean I'm not using it. I'm just not using it as often. I sometimes think about, just for our own self, when I was a kid, you had Crest. You had Crest, and I think you had Colgate. And you go to that shelf of everything that you can find now for your teeth has grown immensely over, I would say, the last even 5 years, on the things you're able to find to do for yourself, but all the different varieties of toothpaste, those that will help your teeth, those that will help your gums, even in liquid form. Just the sight alone can be overwhelming. Which of these two? Do I get one with charcoal? Do I get one with, you just don't know. But in a sense, it's good because we've got all of these options. So you may need a toothpaste for sensitive teeth, or a mouthwash that has different flavors. So those are just a few of the tools, and you all know those. You know what they are, because you're overwhelmed sometimes with the options that you have in the toothpaste aisle.
Well, and I think those are important. I also think talking to your dentist, don't have any secrets from your dentist because they've heard it before. Even if it's the first time they've heard it, it won't be the last. And so just don't keep anything from them. Make sure they know about medications you're on because medications can lead to lots of things. I think we talk about monitoring for signs of oral health issues too. So, one of them that you're going to hear a lot about is chronic dry mouth with people. That can be a major health issue. It can also be a result of medication. I know there are lots of medications I've been on over the years that cause that. And so making sure you have that list of current medications when you're talking with that dental, professional. But there are other things to be looking for too. So pain or swelling that's anywhere in the mouth, the face, or the neck, sores, swelling, or growths anywhere in the mouth, a change in the fit of the dentures. That can be an indication of something too. Difficulty opening the mouth. We talked, Terri, you said the red, the swollen, the tender, the bleeding gums. That does happen often as we age, but it also can be a sign of other things too. Gums that have pulled away from the teeth, bad breath that doesn't go away or becomes a daily concern. Of course, any pus that happens in the mouth, dark or discolored spots on the teeth, and any loose or broken teeth, those can become real issues. And so, and I would say if your loved one is not able to communicate any pain, but is maybe favoring one side of the mouth over the other when he or she chews, or is in a part of the face and doesn't normally do that, and you're noticing that, pay attention and maybe get them into a health professional too. So, listening to words, but also kind of listening to those visual cues, if that makes sense when I say that out loud, are important too. So just don't overlook the importance of our dental health and take care of yourself too. And I know it's a lot. And then also don't kick yourself on the days when you don't brush your loved one's teeth. It's okay.
Yeah.
Okay. For your own. For your own.
Okay.
It's all right.
Maybe someday there will be geriatric dentists, like there are doctors now. Maybe there will come a time when their geriatric dentist is specialized just in the older adults' teeth, and those that maybe have Alzheimer's or a dementia of some sort, that they specifically know how to deal with the elderly. Maybe someday, you never know. As we close the show, we just want to remind our listeners that well, everybody specializes now, but not dentists. So, I guess they kind of do, don't they? Yeah, you do. They do specialize, but not in that geriatric way. So maybe someday. We're the show now, and we just want to remind our listeners that they can contact Tina McIntosh for more information and resources to help you through that journey of caregiving at tina@joycehouse.org. Caregiver Crossing is supported by AARP. They are leading a revolution in the way people view and live life after 50. We love that they're working to empower people to choose how they live as they age. And a big thank you to Majestic Care. Majestic Care provides community-based skilled nursing throughout Indiana, Ohio, and Michigan, specializing in clinical services based on local needs.